to the Lipoedema podcast. We are your host, Shell.
And Tiana, and today we are joined by a sleep health expert. It's Rebecca Crittenden. Hello, Rebecca. Thank you for joining us.
Me?
It's
Very
such a
happy to be here.
pleasure. I'm talking about sleep. I'm so excited because I'm a bit of a stickler for sleep habits. So I'm keen to get right into it. Can you just, for our introduction, just how would you describe the work you do today in sleep health?
So I'm the national manager for a department that looks after diagnostics, like diagnosing sleep disorders, as well as treatment and management of sleep disorders, which is arguably the most important part. That's what we do all around Australia. I look after all of our sleep clinics.
Busy job.
Very, very busy. We've got about 100 locations, and I'm the national manager, but my key focus at the moment is education and empowering people to understand sleep health and how important it is to every aspect of an individual's life. So not only that, but also how to get people to understand that so that they can then make better decisions about their sleep. That's my main goal at the moment. That is awesome. Yeah, I had a psychologist appointment last week, and he said people get really bored with me. He said because I tell them, make sure your sleep's good, make sure you eat well, and do some movement. Like, they're like, oh, should I try this vitamin? Should I try this and this and this? He's going, no.
The foundation.
Yeah. That's really powerful, actually, because people don't understand that poor sleep actually, it affects the way your brain activates. So if you have a bad night's sleep, less than 6 hours and choppy sleep, your brain actually fires differently. So we see a lot less activity in the frontal lobe, which is logic and reasoning and emotional regulation. And your amygdala is much more active. So you go into that lizard brain, and you activate fight or flight much more quickly. And we know that poor sleep is linked to depression and anxiety, and also like psychiatric disorders like schizophrenia. So when they say get enough sleep, they're not mucking around. You really do have to get the good amount of sleep, which I guess leads to the next thing, if that's okay. How much sleep should you be getting? Is that a nice?
Yeah, let's do it.
Go for it. Yeah. So most people don't realize that you actually need, for men, 7 to 9 hours, and for women 8 to 10 hours. And it's not just about how much sleep you get, it's the quality of the sleep. So within sleep, you've got certain stages. You've got your transition stage, which is a light sleep, all the way through to your deep sleep, your stage 3 sleep. And then dreaming is critical to emotional health and mental health. So you could sleep for 8 to 10 hours, but if you're not getting good sleep, it's actually doing more harm than good. So that's probably the biggest thing people don't realize, is they actually have to go into a deeper sleep to get that restorative aspects.
So you're saying if you're dreaming, that's an indication that you're getting that nice deep sleep?
That's actually a great question. So REM sleep, rapid eye movement, is not actually deep sleep. It is a sleep where you are in a lighter stage of sleep, but you're more likely to stay in that sleep. So that's why you see all those reels and memes about people dancing to their alarm clocks. It's because our brain will actually use external stimulus and integrate it into a dream to keep us in that stage of sleep. So babies spend most of their night in REM because they're able to come out of it a bit easier. Whereas adults, our body wants to retain that REM sleep. So it will integrate your stimulus into it.
So interesting. First of all, because I have a almost 2-year-old now. So like the sleep is not always disrupted, but disrupted enough to feel disrupted. But also I had the weirdest dream last night. It was the most whacked out, like creative thing I've ever dreamt in my life. And I couldn't tell you about it at all. And nobody wants to hear about anybody's dreams because it's really boring. But that's fascinating because that was the weird, and it takes, as you were saying, it takes like the external stimulus and like integrates it into your dream. I wonder what was happening externally.
Yes.
Because damn, that was weird.
So dreaming is really interesting. So your frontal lobe, that logic and reasoning, actually becomes less active. That's why we actually believe our dreams. But dreams are simply, they call it like emotional salve. So if anything's happened in your life or in your past or with your children, anything at all that's going on in your life, your brain will actually integrate that into a dream so you can work through it. Whatever mental issues you're having, discussions you want to have with someone, fights you might want to have with someone. But because you have no frontal lobe activation to put a bit of logic and reasoning, it will get wacky and wild and very interpretive and philosophical, which is why you always wake up and go, what was that? It's like, no, it was something, but you got to pick it apart a little bit if you can remember it.
That's the thing. And it sort of feels like it gets further and further away. So when you wake up in the morning, it might be pretty vivid, but you sort of got stuff to do when you wake up. So you don't like write it down or think on it. And then the memory of the dream gets further and further away until like I can see aspects of the dream, but it's so foggy and far away that it wouldn't make sense to even, it's interesting.
More of a feeling sometimes. Yes, you don't remember much with this sleep. In fact, you have to be awake for at least 6 seconds to convert things to memories. So you said you have a 2-year-old that probably is waking you up. So you might remember waking up 5 times, but I put good money woke up like 30 to 40 times, because every time someone in your room moves, whether it's your bed partner snoring or kicking or snorting, you will wake up literally every single time. So I did a sleep study where I thought I had a good night's sleep, but I actually stopped breathing 12 times an hour and for up to a minute at a time. And I woke up something like 17 times. So we don't really know what's going on in our sleep. That's probably the biggest thing to know is you think you know what's happening in your sleep, but you really, really don't. And that's where the key to health lies, is understanding your sleep quality and what's actually happening, because you will not remember it.
Oh, and I always say I'm a great sleeper. Maybe I'm not.
Maybe I'm not. How accurate are things like Garmin watches and those wearables that track your sleep?
Yeah, that's a great question. So we recently went to a sleep seminar in South Australia, and they were talking about the Samsung watch and the iPhone. So I'll talk to those things specifically. They say that if you come back with a sleep apnea index that's moderate to severe, so stopping breathing more than 15 to 30 times, it's very likely that that's accurate. Where we get a bit less accurate is if you have mild sleep apnea. So I probably should explain what sleep apnea is. It's probably the most important thing for someone's sleep health. Sleep apnea is when we stop breathing in our sleep and we have to wake back up again to breathe. So it's extremely common. 1 in 9 men have got it. 87% of people who've got sleep apnea won't know they've got it. And women, it's critical for us because when we hit menopause, we actually become as high risk as men. But on top of that, we are much more impacted by sleep apnea than men are. Someone like myself who does stop breathing, on the 10, 12 times an hour, I need to manage it with CPAP therapy, because if I don't, I'm going to be much more tired. It's going to impact me. So a lot of research shows that we need to consider sleep health between men and women really differently, because the way the hormones are affected by sleep apnea. So sleep apnea is, like I said, very, very common. Millions of people in Australia have got it that don't know it. Women are often misdiagnosed because we do things like we check their iron and we get blood tests. But realistically, every single woman going through menopause and every single woman who's tired in the morning or wakes up with headaches has to have a sleep study. It's the best way to start when you're looking at your overall health. And we know that poor sleep impacts lipedema significantly because of the inflammation response and the way that the body heals. So when I was looking into this, there isn't a lot of studies that link sleep apnea with lipedema. However, what I do know is that poor sleep is the number one result of sleep apnea, that's stopping breathing in your sleep. So if you've got sleep apnea and you're not managing it, everything else that we do for our health is kind of not going to work. In fact, they know that if you've got sleep apnea and it's not managed, if you take antidepressants the next day, they don't actually work as effectively because you're not treating the root cause. Yeah.
So with sleep apnea specifically, because I definitely had it when I was pregnant, because my husband told me, he was like, you are quite loud in your sleep and then you stop. Yeah, you stop breathing. I'm like, okay, well, that's apnea and there you go. But I didn't do anything about it because
You still had it, yeah.
I was pregnant, and I was like, well, let's just wait and see. And if you are not a loud sleeper, could you still have apnea and not snore? Or do they? Yeah. Okay.
Snoring is a really big indicator that you are having airway patency issues. So the airway, when we're snoring, it starts to flap like a sail. With the airway starting to drop. And most people who've got snoring will try the nasal strips and find it's not very effective. And that's because the issue's down here. Now, with sleep apnea, you could have really quiet snoring and still have your airway collapse. I'm not a loud snorer and my airway is still collapsing. Not to spook you now because you're out of the danger zone, obviously. But if there's any people who are pregnant and watching this and they're noticing there's something going on with their snoring, having a sleep study is actually really important. Many people don't realize that it can increase the risk of preeclampsia. And poor fetal outcomes. So a lot of doctors possibly aren't noticing those symptoms or are saying, yeah, it's transient, let it go away, let it pass. But it's really important if you are pregnant to get your sleep investigated if you're noticing that. But yeah, everything's fine with yourself. But just that I would be remiss if I didn't mention that.
Yeah, no, that's responsible. And so the sleep study, that's when you get a device either in your home or you go to a place and they monitor your sleep in some way. Yeah. Talk us through the process of a sleep.
Yeah. So a sleep study can be done 3 ways. So you can do one in the home with a level 2 device that's Medicare funded. You need a referral from your GP for that. You go to a pharmacy or a sleep clinic. They wire you up with about 14 sensors. It's not the most fun, but it's not painful or too uncomfortable. You sleep overnight, and then a physician will report on that test. The other way you can do it would be to go into a hospital and get monitored. That's less common because it is very expensive, and it's usually reserved for people who've got really serious comorbidities or maybe some sort of, impairment that doesn't allow for safe monitoring at home. Lots of people will do that nowadays. The third way that you can do it is with something like a sleep ring or a level 3 test, which is privately funded, but it's not as it's no leads. The ring just goes on your finger, or you can wear like a sensor across the forehead. So that's still really good, high quality data, especially the ring. That's something that I work with. The ring looks at your parasympathetic and sympathetic system to see how that's activating and make sure that your sleep quality is showing rest and digest sleep while also showing sleep apnea. So that's my personal preference. As someone who's been in sleep for 17 years, I really enjoy that product. But you can do it any which way. The key is to make sure you speak to your GP first and advocate for yourself that you would like a sleep test. Because, like I said, a lot of GPs are first starting with maybe blood tests and things like that, or hey, you're just going through menopause, you're going to be tired. But realistically, no, you need to investigate your sleep.
Yeah, that's a good tip. I just want to move away from the apnea specific conversation and go to more general sleep disturbances. So can you talk us through what happens to us when our sleep is compromised, like short term and then medium term and then long term?
Yes. So you've got things like, so there's a few different things that can go wrong with sleep. You can have insomnia, so difficulty initiating or maintaining sleep, but it's usually never primary insomnia. Usually it's caused by something like life stress, lifestyle, maybe a child's keeping you up, or your bed partner is snoring. So that's insomnia. Chronic sleep deprivation is usually caused by behaviors. So maybe we don't actually give ourselves enough time to get to sleep. We're going to bed at midnight knowing full well we have to be up at 6 a.m. So you are causing yourself sleep deprivation. Be short-term effects would be things like headaches in the morning, feeling fatigued, excessive consumption of calories. If you can't get your enough sleep at nighttime, you're going to need to get energy elsewhere. So they've shown that you eat about 500 more calories a day, which is about 4 kilos extra a month. So we know that we eat more when we don't have enough energy. Poor mood is a really big one. So feeling irritable, moody, anxious, depressed. You'll also notice a lot of more inflammatory responses. So if you've got the flu will not pass as quickly. You might find that you're much more tired or sore. So if you suffer from chronic inflammation, that's going to be much worse. And then long term is really significant. So you've got an increased risk of heart attack, heart disease, stroke, mental health disorders. And then you'll start to notice things like oxidative stress. So the body will start to go into an inflammatory response. So you could end up with things like this higher correlation with cancer and diabetes. So it's very significant. And a lot of people will tell you, oh, I only need 4 hours sleep a day. If that's the case, there should be studied because you've got short sleepers and long sleepers. A short sleeper is a very rare phenomenon where someone needs less than 6 hours sleep a night.
Wow. And like you did say that, like rest and digest, like that's why sleep is so important. That's where our body gets to recover. Like our cognition closes down, our reptile brain can just do what it needs to do to make us survive and be ready for the next day. So it is so important.
Yes.
Yeah.
Yeah. No one really knows what the purpose of sleep is. We know that things like energy conservation is really, really critical. So 1 hour, 10 minutes of resting in a dark room is equivalent to 1 hour of sleeping. So we know that energy conservation really happens during sleep. You get brain waste disposal, so we get rid of the toxins out of our brains, which is what prevents us from getting things like dementia and Alzheimer's. We also know that obviously the emotional regulation we talked about. We make T cells, so we actually create cells in our body that help to fight disease and inflammation. So there's a few things they know if you don't get enough sleep, that's what happens. But really, it's all about that energy conservation and going into that rest and digest stage of sleep.
Yeah. Yeah. And what does good sleep health actually mean in real life?
Good sleep health for me is making sure that you have a regular pattern. So our bodies we love patterns. We love behaviors. So going to bed at the exact same time, getting up at the same time, trying not to get up after a REM period because you'll feel quite foggy and drowsy, really protecting your sleep. So when we talk about sleep hygiene, that's the behaviors that we engage in at bedtime. Okay, so not to be crude, but the bedroom should be for sex and sleep. That's it. You shouldn't be working in your bedroom. You shouldn't be eating in your bedroom. You really shouldn't be scrolling. Scrolling is probably the biggest thing that affects. We know that even if you turn off your blue light on your phones, you're still going to affect your melatonin, which can stop you from initiating sleep. So if I was going to give someone some advice on how to get really good sleep, I'd tell them go to bed at the exact same time, wake up at the same time, facilitate a period where you could have 8 to 10 hours of sleep. Get morning sunlight as soon as you wake up because that starts to activate the production of the melatonin for bedtime. Because as we start to get less and less daylight, we start to accumulate more of our melatonin to put us to bed, put us to sleep. If someone was saying to me, Beck, I go to bed at 3 a.m., that's just what I do. That's my behavior that I've set up and I want to change that. What you do not want to do is go to bed at 11 o'clock the very next night because you are not going to go to sleep. So what we look at is really small changes where we pull the bedtime back by 10 to 20 minutes a day and start to change those behaviors. If you do have insomnia or you can't get to sleep, the worst thing you can do is lay in your bed. You actually need to get out of the bedroom. Yeah, so the brain creates patterns. And yeah, so if you lay there, you're actually going to get more and more stressed, and cortisol is the enemy to sleep initiation. So just get out of the bedroom, go have some warm milk, go read a book, don't scroll on your phone, and then only return to the bedroom when it's time to, when you start feeling sleepy again. And keep doing that. It could take you a few weeks up to a month before your brain starts to recognize the changes in behavior and starts to initiate that sleep. But I have a colleague who she goes to bed the exact same time every night, takes her sleep very seriously. If you try to keep her up past that 8 p.m. bedtime, you'll notice her start to get drowsy and not be able to stay awake because her body's so in tune with going to bed at the same time. Same with children. You've got to have a good routine. Otherwise, you're not telling the brain it's time to switch off and move into those sleep stages.
Makes me feel really validated because I'm a real stickler for sleep. I have a pretty intense nighttime routine that's like red light and my lymphatic pump and reading and my bloody eye mask and my earplugs and then I have a child that sort of ruins it sometimes. But you know, I've got 3 kids and the twins were absolute struggle to get into a good sleep routine. But once we got all that education to help them through their sleep, and once it clicked for them, which was probably at the age of 16 months, because we stuck to a routine religiously, they were incredible sleepers. And with Nova now, we do exactly the same thing every night. I have a bath. I go into a room with the red light. I get her changed, give her a bottle, and she walks to her bed, lies down. I put the blanket on her, give her a kiss, and walk out. And like, you know, this week we've heard a little bit from her, but usually there is not a sound and she's going to sleep. And it's because of that consistent, like boring, consistent. And that doesn't work for people that like variety. I'm not a variety is the spice of life kind of girl. I'm like a predictable is the spice of life kind of girl. So it works for me. But I feel sorry for people that aren't as boring and predetermined as I am that would really struggle with that.
You've got to do it, honestly. And I think that we have to start thinking of sleep as a real privilege. It's not something that you're going to miss out if you don't get to sleep. It is such a blessing and a privilege to get good sleep. Ask any new mum that's got a baby that wakes up throughout the night, they will tell you, I wish I could just get to sleep. So yeah, absolutely. We've got to prioritize our sleep. And honestly, there is some schools of thought that you can't catch up on a sleep debt. You should always try. But if you are chronically sleep depriving yourself and saying, oh, I'll catch up on the weekend, there's a lot of research that shows that doesn't work. You need to prioritize your sleep daily, each day. Yeah.
I'm going to just one more comment and then I'll get back to the questions. But it baffles me then how evolution has given us, especially women, given us children, and then society has made the men work or go off to war or go and hunt and stuff and be away, so the women have to take care of the children 24 hours a day and the children don't sleep, and so the women don't sleep, but we need sleep. And it's like, that's a bit of a flaw in our evolution, isn't it?
I think that's why we were supposed to have babies in big communities where you could pass the baby off while you go have a nap. My sister's currently, I've got a newborn, and we just say to her, yep, give me the baby, you go have a nap, because you're supposed to sleep. That's why they sleep so much when they come out. But we have this idea of, okay, I've got to get everything done. I have a perfect house. I've got to go to the gym. I've got to lose the weight. It's like, no, grab a nap, honestly. It's the best thing for you. I remember I was sick one time with the flu, and someone said, go have a nap. And I said, oh, no, I don't want to. Is it really that impactful? And I should know better. So I did some research, and I said, yeah, actually, if you have a flu shot, to give you an example, if you have a flu shot and you don't get enough sleep the next night, your body won't make as many antibodies as if you'd had the right amount of sleep. So it's just, you can look up any disease, any condition, what doesn't matter what it is, and you link it up with sleep, it will tell you the science behind what not getting enough sleep will do to your body. Yeah.
Okay. Oh, I have 2 questions before we go on with the normal questions.
Go for it.
It's almost like troubleshooting questions. So just the first one is disrupted sleep, as in, like, kids aside, you are waking up multiple times a night to go to the bathroom. What's that about?
Yeah. So when we really shouldn't need to urinate throughout the night unless there's something going wrong. So if an individual is telling me that they're getting up to wee like 10 times a night or even 5 times a night, it tells me that there's something going on with their sleep. That's not good. So again, one of the biggest causes will be sleep apnea because it causes intra-abdominal pressure on the bladder, and it also changes the production of different hormones that regulate us going to the toilet. So there's actually a hormone that tells us when it's time to go and not go. So little babies, they don't have that because they just when they're nappy. And as we get older, we start to develop that hormone. So if you're getting up to go to the toilet a lot, you're either drinking way too much fluid before night, sugary drinks, soft drinks, even ones without sugar, they're the biggest irritants to the bladder. So I'd be cutting that out 4 hours before bedtime. Other disruptors would be gymming right before bed, which I'm really notorious for because the day is so busy and I finally get to go to the gym at night time. Exercising within 4 hours of your bedtime can also affect your sleep quality. Same with caffeine. So even trace amounts of caffeine and like soft drinks will affect you being able to get good sleep, and it'll wake you up more. The other big thing people do, especially in our society, is they eat big heavy meals too close to bedtime. And what happens is when you go to bed, your body is actually working overtime to digest the food. So you will wake up a lot more, because it won't take you into those deep stages where you can really, really get into that restful period, because you need to digest your food, and that happens in lighter stages of sleep. So eat early, don't have caffeine, reduce your water, and if you are waking up to go to the toilet frequently, get a sleep study.
Good tips. The other one was just about napping. Because I have such a regimented sleep schedule, there is no way I can possibly have a nap. I never nap during the day. My dad is a religious afternoon napper.
Okay.
And he can get himself to sleep within 60 seconds and have a 10-minute nap and then wake up and feel refreshed religiously every day. I cannot nap. I feel worse, groggy even, when I go for a nap. Can you explain napping?
Absolutely. When you look at sleep, it's not just one period of sleep. You're going through stages, so you cycle. Now, what your dad's doing is he's able to get out of sleep before he enters the deeper stages, which are harder to come out of. So if you're napping for like 40 minutes, an hour, you're going to wake up in those deeper stages, or the REM stage is the absolute worst. That's when you're really groggy and you physically feel like you can't move. So realistically, you shouldn't need a nap at all. For me, getting enough sleep and then napping tells me the sleep you're getting is not good enough. It's causing you, you're still fatigued throughout the day. The biggest thing I had to learn, and it took me, I knew it theoretically, but now I actually know from my experience, if you get enough sleep and it's proper sleep and you're going that parasympathetic activation and you don't have sleep apnea, you actually should have well enough energy throughout the day to exercise, to work, to look after your family. You should actually not need to have a nap. So if you find like, oh my God, I need a nap, I'm so tired, I can't get through this activity, or you can't get through a movie without falling asleep, something is amiss, unfortunately. But if you do want a nap, set a timer, give yourself a few minutes to fall asleep, and then don't sleep longer than 20 minutes. And do not do it before bedtime, because you will not be able to sleep.
Great tip. Excellent. I'm done with my questions. You can keep going. Sorry.
It's
So
a
if
hot topic.
yeah. If someone's struggling with sleep, what should they do? Like, I know we've spoken about, how exercise and drinking water and all those things affect how you sleep, but what is something they can do if they're struggling?
If I had someone so if you start with the basics. So obviously not napping, sunlight in the morning, regular bedtimes and regular wake up times, really critical. I would tell them to start looking at more interesting options. So melatonin is actually not something you really want to engage in until you're over 55. That's why you need a script if you're younger than that. There are some schools of thought that say that you are depleting, but of course you take your medical direction from your doctors, not from me on this podcast. But yeah, you definitely want to look at the more natural remedies. So magnesium is a really good one. You want to make sure that you're probably having milk has got tryptophan in it, which is really good for falling off to sleep. I am a big fan of sleep hypnosis audio from like YouTube. There's a few good ones. I like Bossing Thoughts. He's really good hypnosis for sleep. Yeah, things like that is what you want to maybe look at. Definitely making the house really quiet with lots of lights off, not scrolling in front of it. It's so hard to get out of the habit of it. But unfortunately, that does stimulate us to be awake, really, even if the blue light filter's off. Especially if the blue light filter is on, you are not going to sleep because blue light blocks melatonin. So I would tell them just to start working at it and not panic about it. Panic is the worst thing that you could do. So yeah, just really initiating good behaviors. And if you really, really do need to get some support from your doctor, then something like melatonin as a short-term solution or some sort of muscle relaxant is also very helpful, just to get you back into that habit of sleeping.
Good tips. Yeah. Practical.
Yeah. We need prep. I'd also be looking at your bed partner's behaviors. So there's some studies that show that if your bed partner has poor sleep and has got sleep apnea or snoring, you will wake up in the exact amount of times almost that they wake up. So your bed partner's behaviors can be really, really disruptive. That's why a lot of people have to sleep separately. And also pets as well are a big one for poor sleep. So jumping on the bed throughout the night, needing to get out, all these things that pull us out of sleep make us have to start the cycle again.
I'm the opposite because I just got a new puppy and I was crate training her and had her in the crate. And then she'd wake up at like 1 a.m. to go to the toilet. And so then I'd take her back to bed with me. So that became a habit. She'd wake at 1 o'clock in the morning, knowing that I was going to take her to the toilet. So the last couple of nights, I've just let her come straight to bed with me and we've slept through.
When you get doggy cuddle.
And it's only a problem if it's a problem. So if you wake up without headaches, you wake up feeling refreshed, you've got enough energy to get through the day, then that's fantastic. Who cares? If you find that you're foggy throughout the day and you're struggling, then obviously maybe look at whether or not she's kicking you. The worst night sleeps for me is when my 4-year-old jumps into bed, same thing as with me, jumps into bed, wants to cuddle at 2 a.m, and then I will have the worst night's sleep for 4 hours because he's kicking me and moving and shuffling and slapping me in the face. It's so much easier just to put him in bed and give him a cuddle, but it honestly is so much better for your life just to jump up and put him back into bed.
Yeah. Yeah. We instigate these bad habits otherwise.
I never co-slept with my kids. I think because I had twins to begin with and it was just too overwhelming anyway. And I look back and think, what a missed opportunity for all the cuddles. But I'm really grateful that they had that really good sleep hygiene. And I think over Christmas time, I had to sleep in the same bed as my almost 9-year-old twins. And then we had Nova in the cot in the same room. So I had all 3 girls and I was getting kicked in the stomach and like slapped in the face. One of them was coughing and I was like, this is bullshit. I've never done
this. Is a nightmare, yeah.
Yeah.
It's not really co-sleeping. It's just co-inhabiting a bedroom.
Yeah, co-fight club.
Yeah, my kids were straight into their own bedrooms. Yeah, I was like, yeah, I love sleep. I love
sleep too.
Yes. Yeah. Co-sleeping is such a sweet thing to do. And it's so, like they say, it's so ancient, but honestly, from someone who, you look at the brainwave activity and you look at this, like what your, like say, I used to look after hundreds of patients and the things that they would say and do and the positions that they would lay in. And I'm like, you have no idea what you're doing when you're asleep. It doesn't matter what anyone says. You don't know what you're doing. Say and do it. It's just not something that I think you probably want to do, honestly. Yeah. It's just you're unconscious. You don't know what's going on in the world. So, which is good. That's what you want, right? You want to be completely out to it and not know what's going on. But yeah, definitely. Yeah.
Yeah. Give me a break from the world for 8 to 10 hours.
Oh, heaven.
And yes. Yeah, absolutely. Yeah. That's why it's so critical.
Right, our last question, Beck. If you could leave listeners with one idea that would genuinely shift how they think about their sleep, what would you want it to be?
I would want people to advocate for their sleep health. I would want them to advocate against their own expectations of themselves, so that they think they're going to do this, this, and this. No, sleep is the most important thing. So you need to make sure that you're facilitating a lifestyle that gets 8 to 10 hours. And if you are tired, if you have 8 to 10 hours and you're still tired in the morning, you still feel fatigued, you need those naps in the afternoon, then take yourself to a doctor and get your sleep investigated, because if there is something going wrong, it's so easily treatable and effectively treated that you will be able to reverse it so quickly. So you need to advocate for yourself. You need to stand up for yourself. Make sure that you're not having people who don't respect your sleep, like family members that maybe want you to do this and this. And also give yourself a stern talking to. You need to get 8 to 10 hours sleep if you're a woman. And that's just how it has to be, because if you don't, you'll always be trying to do catch up, and maybe you'll go and look at all different avenues to improve your health, supplements and blood tests and exercise and eating differently. If you're not getting good sleep, you are going to be putting yourself at a disadvantage, and that's just not what we want with our busy lifestyles.
Yep, so simple. So you did mention there about going to your doctor, seeing what's wrong, getting a sleep study. What are some of the treatments? If something comes back, what are some things we can do, like medically?
Yeah, so it depends on the root cause of the sleep apnea. So the gold standard, no matter who you ask, is CPAP therapy. And a lot of people get a real phobia of that. Wearing a mask to bed, I can't even imagine it. It's so cool. It's so, so effective. And you look at medicine, it's probably one of the most effective treatments for any disease, because it's so mechanical. It opens up the airway, it's gentle, it's comfortable, it's beautifully effective. So that's probably the main thing I would say to look at. And if you get a really good practitioner, like someone who knows what they're talking about, they will educate you and make you understand, and get you a good comfy mask. If you've got excess weight around the face and the throat, you could look at weight loss. My recommendation would be CPAP to facilitate weight loss. They are saying that things like Ozempic and whatnot are used as a treatment to help with rapid weight loss. You can also look at surgery. So surgery there's a couple different types. They can laser out the throat to open up the airway. It's not as effective. And some people will look at pulling the jaw forward mechanically. I would recommend, if you are going to do a sleep study, you find that you've got sleep apnea, you need treatment, to make sure that you give the CPAP a go first, and then look at other options, because it really is going to be your most effective one. And then, there's a real stigma around it. Yeah, it's really comfortable, honestly. And it's only at nighttime. And there's a lot of studies that show that it increases collagen, helps with repair of tissue. So it actually can help reverse a bit of aging. And it does help weight loss significantly. And for men, if there's any men watching or family members of men, sleep apnea and CPAP are amazing, because when you've got sleep apnea, your testosterone and your erectile dysfunction are very compromised. So you might find that, if you've got people listening who, like my husband's depressed and angry and no sex drive, a sleep study could be the key. Yeah. And hormones are massively impacted. If your airway's already open, CPAP may not help. If you're snoring and you don't have sleep apnea, CPAP will help. But every time you stop breathing, your body releases cortisol, the stress hormone. And every time that happens, your testosterone spikes. So for women, that really affects our hormones negatively. And for men, it kills your testosterone. And it causes a lot of oxidative damage and inflammation every time you stop breathing. And I've seen patients stop breathing 120 times an hour. That's not uncommon, actually. Most people I look at have got severe or worse, because once you're asleep, your airway wants to collapse and you have to wake back up again to open it. It doesn't open up on its own. We love sleep, and good sleep, not just sleep, good sleep. That's another thing. If you need good sleep. Thanks for having me. See ya.
If you're looking for simple ways to feel more supported in your daily wellness routine, something we've been really enjoying is incorporating essential oils. We've been loving Eco Modern Essentials, an Australian essential oils and aromatherapy brand that makes wellness feel easy and accessible.
Their high quality and thoughtfully made oils and blends are designed to support small, meaningful rituals, from winding down at night to adding a little extra care into your self-care routine.
When it comes to lipedema, we know many of you are already exploring natural ways to support lymphatic drainage and feel more at ease in your bodies. Eco stocks premium oils like ginger, lemon, grapefruit, cedarwood, juniper, and lavender, which are traditionally used in massage and lymphatic routines.
Adding in essential oils is an easy and delightful ritual I genuinely look forward to every day.
You can explore the full range online at Eco Modern Essentials and receive 20% off with code LIPEDEMAPOD.
Lipedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipoedema podcast. Until our next episode, bye for now.